Good afternoon and thank you for joining us for today's coronavirus press briefing. I'm Caroline James in for Donna Bush. A warm welcome to our viewers on CIGTV YouTube, Facebook and our listeners on Radio Cayman. If you're watching on YouTube, a reminder to subscribe. You can hit the notification bell and stay up to date with all our latest content. We're going to start this afternoon with a prayer from Pastor Andrew Ebanks.
Hi, I'm Pastor Andrew Ebanks of the Cayman Ministers Association. Would you join me in prayer today, please? Almighty God, we thank you for your mercy and your grace that covers over us in the midst of difficult circumstances. As the psalmist says, that when the cares of my heart are many, that your consolations cheer my soul. And Lord, I pray that over our nation today, over these Cayman Islands, that Lord, your consolations would cheer our souls in this time where our cares are many. That Lord, that we would be able to cast our cares on you today because you care for us. That you have not left us, you have not abandoned us, but that Father, as your word reminds us constantly, that you will never leave us nor forsake us. And so I ask today, Lord, that you would give us wisdom as a nation, that you would give wisdom to our government, that Father God, that you would help us to put in place the measures and follow the measures that have already been put in place for our safety and our protection and for good health and life. I ask, Lord, that you would be today with all of our emergency personnel, all of our essential services, Lord, and that you would cover and protect every single one of them, that you would cover and protect every single home and every single person. I ask for a special touch from your Spirit today as you move in our hearts and in our lives. We thank you and we praise you for your blessings on these Cayman Islands. In Jesus' name, amen.
Amen.
Amen. And I'll welcome the panel. We have His Excellency the Governor, the Honourable Premier and the Honourable Minister for Health. So I'd like to invite the Commissioner of Police to give us an update on his latest situation regarding the curfew. Thank you.
Good afternoon. Just to deliver the overnight report there for the period from 6 a.m. yesterday morning until 6 a.m. this morning, the 30th of March. The hard curfew operated well last night, almost full compliance again. No significant policing issues arising over the past 24 hours. Little Cayman, no issues arising at all. Cayman Brac, 12 interceptions by police, one person found in breach of curfew, warrant for prosecution, no requirement to arrest. Grand Cayman, 83 interceptions made by police, 2 persons found in breach. This incident involved 2 persons in a vehicle while the driver was arrested for driving under the influence of alcohol. He will be charged with road traffic offences and breach of curfew. His female passenger was also in breach of curfew and has been warned for prosecution. Looking at this morning from 6 a.m. during the soft curfew, all is going pretty well. Indications are that the message is getting through. Traffic is flowing well. Strategic police checkpoints are in place and they are proving effective across Grand Cayman. Business at the supermarkets is brisk but is well controlled, well managed, and having spoken to a lot of the supermarket operators or retailers, plenty of stock, no need for any panic. There is a small amount of activity on the beach and that's associated with persons out moving around for exercise, nothing like we saw on Saturday. And since 6 a.m. this morning, 3 persons have been found to be in breach of curfew. 1 person arrested during the course of a commission of a crime, another person committing road traffic offences and also in breach of curfew, and 1 other person found travelling in breach of the curfew. They will be dealt with then by way of prosecution at a later stage. Can I just re-emphasise the issue around speeding on the roads? It's becoming a problem. We are receiving an awful lot of reports of people travelling at excessive speeds. Please stay within the speed limits. Do not put other road users in danger. And we repeat, stay at home, Cayman. If you do not need to be on the road during the hard or the soft curfew, you should not be on the road. And I remind everyone again, hard curfew returns at 7 p.m. this evening. Thank you.
Thank you, Commissioner. I'd like to invite questions from the media at this stage.
This is Kayla with the Compass. I wanted to get an update from the commissioner. We had heard a few days ago that certain businesses were still having trouble complying with the orders to keep their workers at home. Has that situation now improved?
Yes, I would say it has improved. As I said, our checkpoints are in place at strategic locations. Under Regulation 9, under the soft curfew, we stop and we ask appropriate questions as provided for under Regulation 9. Feedback is quite good. People understand it. We're asked why you're moving around, what is the purpose of your business. It's not free, unobstructed movement. It's purposeful movement across the island. We're seeing an awful lot more compliance with that, almost full compliance.
Wonderful. And I also wanted to touch on the issue of domestic violence. Are we seeing any concerns there or any spike in domestic disputes?
Last night was the only night we saw an increase, 7 incidents of domestic violence last night. 2 of them are recorded as alcohol related. So we've dealt with them. So it is a small spike one night over the past 2 weeks. So we're going to keep a very careful eye on that.
For individuals who might be in an unsafe home situation, are there options for them right now to get out of that situation, perhaps take advantage of the hotel accommodations that are being offered for quarantine?
This has all been dealt with on a case-by-case basis. Cases are reported to NEOC. The crisis centre remains in operation. People can report, seek assistance, and it's all dealt with on a case-by-case basis. Those are things we're watching very, very carefully in terms of child and family protection.
Thank you.
Thank you, and we'll head now to the Honourable Premier for his update.
Thank you. Hello, everyone. There are no test results today, but Dr. Lee is here if there are questions which need to be asked of him. I turn to my usual report about the progress of this virus across the world. The number of total cases worldwide is now 768,363, up 44,973 overnight. Total deaths globally are now 36,912, up 2,847 overnight. In the U.S., total cases are now 155,969, up 12,478 overnight. Total deaths, 2,854, up 271 overnight. Italy, total cases, 101,739, up 4,050 overnight. Total deaths are now at 11,591, up 812 overnight. Spain, total cases, 85,195, up 5,085 overnight. Total deaths, 7,340, up 537 overnight. In the UK, total cases now are 22,141, up 2,619 overnight. Total deaths, 1,408, up 180 overnight. And New York State, 66,497 cases, up 5,818 overnight. Total deaths, 1,218, up 155 overnight. Overall, I think we are quite happy with the way the curfews, both soft and hard, are going. Things have certainly improved significantly. There are still, we believe, more cars on the road that need to be during the soft curfew. The supermarkets have gone very well today so far. They are not the long queues outside, which were a major problem initially. The banks, though, have reported issues with queues and have requested that they also be allowed to move to the same arrangement that we put in place for the supermarkets. And therefore, as of tomorrow, only persons with surnames beginning with L to Z should attend the banks, and those with surnames A to K on Wednesday. So it'll be Monday and Wednesday for A to K, Tuesday and Thursday for L to Z. Friday will be open to all customers.
Your Excellency.
Okay, thank you. Thank you very much. I mean, first of all, I agree with the Premier. It's reassuring news on the curfews, both hard and soft, and I want to really thank the community for their support and cooperation in getting us to this point. We really can't emphasise strongly enough how important it is for everybody to stay home unless absolutely essential. I do today want to make a formal announcement about the air bridge that I referred to yesterday. So this is an air bridge between the overseas territories and the UK. Although the airport is closed, I have got the Premier's agreement and the agreement of the Foreign and Commonwealth Office to bring in a British Airways flight next week. We don't know which day, but it will be the first half of next week. And I think this is a strong signal of support from the UK to its overseas territories. So the British Airways flight will arrive in Grand Cayman via Bermuda early next week. There will be a charge for tickets. Costs are still being determined, but the Foreign Office will also subsidise some of the costs of this flight. And this flight is for anyone who needs to return to the UK urgently. It's not just for British nationals or for visitors, anybody who wishes to go to the UK. Seats on the flight will, of course, be limited and will be based on a first-come, first-served basis with consideration given to any compassionate cases. If you are interested in travelling on this flight, please call the Emergency Travel Helpline on 244-3333, or you can email emergencytravel@gov.ky. That's emergencytravel@gov.ky. I know there've been a lot of calls today, and apologies if you haven't been able to get through, but do please keep trying or send an email. This flight is also extremely important because it will be bringing the UK and the Foreign Office funded consignment of protective personal equipment for us to use here in Cayman. There will be space on the inward flight for any Caymanians in London who need to return to Cayman. Of course, they will need to self-isolate on return, as previous returning residents have had to do. Anyone who wants to come back from London should contact the Cayman Islands Government Office in the UK. The phone number is +44 0207 491 7772. That's +44 0207 491 7772. Or you can email info@CIG office, cigouk.ky, info@cigouk.ky. We're also exploring a number of avenues around testing. We can't give details on this, but I've also been in touch with a number of people today about possibly using that BA flight to bring some of that equipment in as well, and we'll hopefully have more to say on that in the days that come. I just want to finish today by really, I've thanked the community, but I do want to thank our police service for the incredible job that they're doing at the moment. I want to thank CBC, who are supporting the police, and the special constables, the civil service, which has really stepped up in responding to this crisis. The prison director and his staff, they don't often get a mention, but I know the prison director and staff are doing their utmost in a challenging situation to manage welfare of everybody at the prison. Also, all our healthcare professionals doing an outstanding job on the front line and who we really rely on. I want to thank them as well. And as the Premier said yesterday, our returning students and residents deserve our respect and admiration for the way that they have responsibly behaved since returning from overseas. This may be a long journey. We don't know how long we're going to be in it, but we really are grateful for the cooperation of everybody. Thank you.
Thank you. Minister.
Thank you. Good afternoon, listeners, Grand Cayman, Cayman Brac, and Little Cayman. We continue to monitor the coronavirus situations daily and its devastating impact on populations in nearly every region of the world. The global numbers of this pandemic highlighted by the Premier continues to be alarming. This country is being proactive so that we can keep our numbers as low as possible. As stated, yesterday I provided an overview of the Health Services Authority COVID-19 preparedness plan and the measures their leadership and staff are putting in place. Today, as Minister of Health, I'd like to highlight how pleased I am with the collaborative efforts taking place between the private sector and the Health Services Authority. We are developing a coordinated strategy to enhance our response to contain community spread of the coronavirus and to effectively manage any patients who are infected. We recognize that our fight against this disease is not the responsibility of one, but the whole healthcare provider community. That said, I would like to use this opportunity today to recognize a group of individuals who are leading the efforts to not only combat the virus in their capacity as researchers, but also those on the front line of this pandemic. I am pleased to see the involvement of physician leaders in the NEOC, which includes representatives from the private sector, all whom are driving discussions on key policies, issues to protect the health of the people of the Cayman Islands. Having such involvement from various providers shows they all are working for the same mission, to contain and eliminate the spread of COVID-19. I also attended a physicians meeting at the HSA, which brought together the public and private sector. I was impressed by the level of teamwork between them and the willingness to get to work together in the interests of the people of these islands. I also want to note that this was a few weeks ago before the heightened restrictions on gathering were in place, but I can assure you even then everyone in the room was practicing proper social distancing. When we look at our country's facilities as a whole, we have 3 hospitals. Our bed capacity across these facilities is 246, with approximately 32 ventilators. Those numbers will be expanded with further orders of equipment and PPE arriving this week. It was mentioned last week that other locations are being reviewed as possible backup sites should we have a large surge of positive COVID patients needing hospital management. We are seeing this happen around the world where healthcare facilities are at full capacity and are resorting to backup space. We hope that due to the regulations that have been put in place by our government, that Cayman will not get to that point, but we must have these plans in place. And if we get to that point, we will need all hands on deck. We have already seen private physicians teaming up with the HSA, as well as assisting in different areas of our current initiatives. For instance, private doctors checking in on all university students whom are self-isolating in the hotel to ensure they are well and not developing symptoms. Part of our strategy to contain the spread of the virus is to identify and isolate cases early. This requires the public to be clear on what symptoms to look out for and when to step forward to the HSA for testing. To further support this effort, today we are announcing the launch of an online self-assessment tool open to the public. The tool, which is now live on www.gov.ky/coronavirus, aims to provide a quick alternative to the flu hotlines and hopefully will encourage those who may be unsure if they have the coronavirus symptoms the chance to quickly check and take the necessary action. The tools begins by asking for your symptoms, and then it takes the public through a series of questions to determine whether you should seek further medical assessment, and in all this in less than 5 minutes. We understand that isolation and shelter-in-place measures can leave the public feeling limited, and we all need a welcome distraction from the news from time to time. I am therefore excited to also announce, as Minister of Culture, the launch of a jingle open call to bring out creativity in the time of coronavirus. Throughout history, we have seen music used to elicit a much-needed smile and indeed feelings of hope in the midst of a serious situation. The collection of selected jingles will help to connect the Cayman Islands government with the local community in a creative and uplifting way as we experience the challenges around COVID-19 pandemic. There are 4 categories for the jingle submission, and genre is permitted, and any genre is permitted. A payment of $1,200 will be offered for each selected jingle. The deadline for submission is Monday, 6th of April at 5 p.m. More information, including how to submit your entry, is available at www.gov.ky/coronavirus. The public are asked to contact jingle@gov.ky if they have additional questions. Finally, in closing, every year, the 30th of March, which is today, is observed as Doctors' Day, and I want to recognize the tremendous work of the medical community here in Grand Cayman, Cayman Brac, and Little Cayman, and the good work they do year-round to care for us and our families. Today, we pause to honor our dedicated physicians who work tirelessly for the patients who entrust them with their health care. Today, on Doctors' Day, the doctors of the Cayman Islands have joined together with the Governor, Premier, and Cabinet, and myself in making a single prescription for the people of the Cayman Islands: stay home to save lives. And this Doctors' Day observance on the 30th of March was first started in 1933. On that point about staying home alive, I thought, why is so many people on the road? And some for no reason at all. So I say this country has 134 nationalities, and I thought that I may reach out in different languages to say something with stay home in it, so that may have a greater impact. So I thought I'd add some Spanish and some Filipino, and to try to connect with the people out there. In English, essentially what I'm trying to say is please stay home unless it's essential. In Spanish is quédense en casa solamente si esencial. In Filipino is manatili sa bahay maliban kung mahalaga.
You sure?
Yes, sir.
Very good.
But
Very good.
if I mess that up, I'll try it again. But you know, it's very important for us to stay home unless it's essential. I want to close by adding some words of worship. Worship the Lord your God, and his blessings will be on your food and water, and I will take away sickness from among you. Exodus 23. I thank you, and God bless.
Thank you. Any questions from the media for the Premier, the Governor, and the Minister for Health?
Good afternoon, Ralph Lewis, Caymanian Times. My first question is for the Dr. Lee, and the others are for the Premier. Let's start with Dr. Lee first. We're now into week 2 since we shut our borders and flights were stopped from bringing passengers to Cayman. Do you foresee an increase in positive cases for those who may have arrived with the virus with them?
I think it's a great timing for your question and a good day for me to answer it, because absolutely, we were talking. I've been talking earlier to people about this generational aspect of the virus, and that you need to allow several generations of the virus to burn its way out through, for example, a family. If you have a group of 10 people together, if one person catches it and brings it into the household, then all of the other people in the household who may be susceptible will need to have it, and they'll have it at various times. So it will take a period of time until that generational aspect of the virus can burn itself out and everybody's had the disease.
So we should stay put another couple of weeks.
Absolutely. Please stay put.
Thank you. Thank you, sir. For the Premier, many of our workers, guests on the island, who come from the neighboring territories such as Honduras, Cuba, maybe Santo Domingo and Jamaica, were unable to catch flights out. They're now having some difficulties, some of them, with staying in the Cayman Islands. And my question is, would you be providing, or you going to be providing, complimentary airlift to neighboring territories so some of these people can go home to their families if they need to?
Well, if we have an indication that there are significant numbers of persons who wish to get to their homes within the reach of Cayman Airways, that's a lot easier than flying into the U.S., for instance, in the present circumstances. But we're prepared to look at all of these possibilities, because this is going to be a much longer term event than I think most people truly grasp. We are going to be quite a while before we can open the borders to bring visitors back here again, looking at what's transpiring in the US and the UK in particular, and all around us. But we would need to have some grasp on what the numbers are, and there would also be questions about access to those countries. For instance, we had hoped to get a flight to Honduras even 2 weeks ago, but we were not able to negotiate access there. So there are a number of very complicating factors with respect to this, but we certainly would be interested in looking at how we can help people who want to go to their homeland, or somewhere else for that matter, to leave Cayman.
Thank you. My next question is about small business. Many small business owners are following the rules, staying at home, but of course they have a concern about their viability in the near future. Are you considering a stimulus package for small business?
Not right now. We are trying to get people to stay home. We want businesses closed. We want people to stay home for the next 2 to 3 weeks. We can't even think, well, I wouldn't say we can't think about it, but we certainly can't think about stimulating the economy at this point. We want people to stay home.
My final point is I want to thank you very much with the Minister for starting the press briefing with prayer. Thank you.
A question for you, Premier, about whether the government is considering action to do more to boost the supermarket delivery services, for instance, by redeploying workers.
Well, we certainly have been in discussions with the supermarkets. It's really their call. There are a whole lot of unemployed taxi drivers, tour operators, people who are used to doing deliveries, albeit deliveries of people rather than groceries. But there is really I don't think, any shortage of people available to do that. It is, I think, and I'm not really qualified to answer this, but it is, I think, taking some of the supermarkets some time to be able to get in place the systems that allow more wholesale delivery than is currently the case. And some of the complaints that I constantly get is that it is taking so long, as much as a week from time you place your order till you can get a delivery. So they're going to have to get their systems up to speed to be able to cope with this, plus dealing with the incredible stress that they're all under, just keeping shelves stocked and managing the number of people. But hopefully we will get used to this over the course of this week, and going forward things will be a lot smoother.
Thank you. Kayla.
We wanted to get an update on the number of cases number of testing cases that are still pending, and the inconclusive case when that result might finally be announced.
It's probably for our Chief Medical Officer, who's on his way.
Thank you. So it gives me an opportunity to say that, just to reiterate, I think what His Excellency the Governor mentioned the other day, we've received a supply of the ability to test, and we can now test for just over 500 cases. I'm not sure of the absolute numbers outstanding, but it's in the teens. It's not a huge number that we're waiting for. The inconclusive result, unfortunately, we need to wait for it to come back from CARPHA. I do not know if they've received it. A lot of the supply chains and getting things, although the sample has left the island, are taking a long time to actually reach their destination.
Do we have any individuals who are considered recovered? And in this situation, what does recovered mean? When do we determine that someone is over coronavirus?
In the people that have tested positive for coronavirus, because it's possible that we might have some that have had it and have recovered, but they have not been that unwell. Our current regimen is that we should test them twice before they get released back into the community, 14 days after the end of an isolation period, provided their symptoms have resolved.
Okay, thank you. And I know, Premier, that you've touched on the financial stresses, that there's only so much that government can do right now. Have we seen any kind of indication from the private sector in terms of stepping up to help people in the community that are in need right now? What kind of measures can community members take to support their neighbors?
Well, I know a lot of companies are simply paying staff even though they're not working, which is a huge, huge help. And quite frankly, we are not being overwhelmed right now with requests for financial assistance. I don't think there are too many people that are in a desperate state now. But we do know that this is going to get harder as time wears on. There's only so much that even the strongest of companies can do in the longer term. But again, we are hoping that the suppression measures that we have put in place will allow Cayman to be able to get back to some semblance of domestic normalcy. I say that bearing in mind that we're going to have to keep the borders closed much quicker than most other countries would have been able to, and that we will get some domestic, the domestic economy moving again, and help to mitigate all of the challenges that we have. But no one should believe that this is going to become anything like normal anytime soon. I think we're looking at next year, quite frankly, before the world gets back to some sense of where it was before this crisis began. So, and because our two principal industries are financial services and the global economy is in the tank, and tourism, there's nobody traveling, we are going to be very, very hard hit for quite a while. So we are looking at all of those realities and seeing what government can do with the assistance of the United Kingdom to ensure that we are able to come through this in reasonably good shape.
I mean, I might just add that the UK government is very keen and willing to support all our overseas territories, and clearly Cayman historically has always financially been in a much better position than some of the other ones, but it's already engaging with some of the other overseas territories on these sorts of issues, but stands ready to support the overseas territories.
Wonderful. And we know that many Caymanians, many residents will be feeling the absence of their first paycheck this week. They'll be having difficult conversations with their landlords. What advice do you give for navigating those conversations? And do you have a message for landlords that might be tempted to evict residents at this time?
Well, if I were a landlord, the last thing I would be trying to do is to evict one of my tenants now. I'd be working very hard with him or her to find a way that they can stay there, because I expect that there are going to be a surfeit of places to rent in the next little while. As it becomes more and more apparent to businesses and to workers who are here on work permit that there will not be work here for the medium term, I believe many of them are going to attempt to leave. Ralph just asked a question. I'm starting to hear it myself. How can I get home? And then landlords are going to be left with a lot of empty apartments. So if I were a landlord, I would be working really hard with my tenants to be supportive and helpful to them so that they are encouraged to stay, those that will stay. As I say, we have a lot to be thankful for with respect to the banks. All of them have offered significant payment holidays for significant periods, so that if a landlord is paying a mortgage, he or she should have a break there. No one's getting their water turned off. No one's getting their electricity turned off. So essentially, we can focus on essentially putting food on the table if money becomes an issue for the time being. So I would encourage everyone to hunker down. Let's ride out this particular bit of the storm. Let's see if we can get Cayman collectively in a place where we can start to open back up the domestic economy and people can start to earn incomes again, those who are not currently earning. But we are most grateful to the many banks and companies and indeed other businesses, supermarkets, even the duty-free folk who are earning absolutely zero, for continuing to pay their staff for a period of time. As I say, we know that's a finite period because you can only go on so long before you actually go bust yourself as a business. We understand all of that. But if we can hang on for a month, I think we might be in a much better place.
Great. And you hinted at this in one of your earlier answers, but in terms of keeping the border closed, at what point do we need to see the rest of the world get to in terms of containing this virus before Cayman might be able to consider letting visitors back in?
Can I ask Dr. Lee to respond to that? We had this discussion just a while ago.
I think actually the answer is probably going to come from science and the developments around either testing or vaccination, because I don't see this disease burning itself out throughout the entire world for quite some time, as the Premier has suggested. I agree with him absolutely. But if we get to a point where we can test people and know whether they are immune to it, then that's a point at which we'll be able to relax a lot of things that we currently have locked down, both here and in the wider world.
So the one thing that comforts me when we get these big questions, which I just can't work out the answer, is that every country in the world is going to be grappling with the same issue. So a lot of very brilliant minds are going to be, and I'm sure already working on this issue. And that does give me some degree of comfort and optimism that buoys me up in my darkest moments, when I wonder, when we would be able to do something like that, because we can't close the borders indefinitely. A point will come when we'll starve to death because we won't have any money to buy anything. So it'll be between the devil and the deep blue sea then. But hopefully some of those answers will come fairly quickly.
And touching on a medical question, again, we're seeing a lot of people sewing and making their own face masks. And we had seen earlier guidance about face masks, that not everyone needed to be wearing one. And I wondered if you could touch on that and the safety of DIY face masks.
That's quite a long conversation, but I think it's been going around today in particular, so it's apposite that I should attend to it. Yes, the guidance has been that major public health agencies have been advising against the use of face masks. I think this is partly from constraints in supply. But then if you look at other cultures, if you look at Hong Kong or China or Japan, they've been culturally much more receptive to wearing it, possibly in Hong Kong from their experience around the SARS epidemic, where they knew that wearing the face mask was something that you had to do to protect yourself. If the whole country, if everybody around you is going to wear a face mask when you're out and about in the community, then I cannot but see that you're going to help protect yourself. Because although wearing a face mask does not protect yourself, it actually protects the person that you might come up against by protecting any droplets from you from going that way. Any droplets that are coming your way will soak through the mask if the mask has been used, but it will stop droplets going that way. So if everybody's wearing a face mask, there is sense to that, which is why this is surfacing in the media and social media today. Along that lines, clearly we don't have the supplies for medical face masks, surgical masks to be provided, and because we're reserving those for the frontline staff. Lots and lots are on order, but at the moment we don't. There is information out there, absolutely, for making homemade masks, and it is just a question of stopping the droplets from spreading. So we're looking at that issue at the moment in the National Emergency Operations Committee and in
Thank you very much for joining us. Apologies for the technical difficulties we've been experiencing. We'll pick back up with Minister Seymour.
Yeah, I'm not sure exactly where it cut out, but if we might step back to the question about the possibility of doctors coming from Cuba.
Yes, thank you for the question. As Cuba is one of the places that we have found interest in sourcing doctors from, nurses, and we have actually contacted the Cuban ambassador of Jamaica, and they have put us on to some of the contacts. So we're on the discussion is going on.
Can I just make a point, Kayla, because we're getting some questions about the proposed BA flight.
Okay.
I mean, just to say that the primary purpose is for people here who want to go to London and for us to bring in this personal protection equipment. But as it's a flight coming from London here, if there are some Caymanians in London who wish to come back, we think there are a small number, we would make that open to them. But they would be required by law to self-isolate on return. And the BA crew that come in won't be leaving the airport, so there's no risk to us here. And I just want to say as well, this whole question of testing, just to say that all of us are heavily engaged behind the scenes now in trying to get us into a much better position on testing. And indeed, in the last couple of days, we have been pursuing an avenue through South Korea, and I've asked the British Embassy in Seoul to help us do due process on a particular company that can provide actually huge amounts of testing equipment and materials. So I think this is really promising and really exciting, and there's a lot of work going on behind the scenes to try and make that happen.
Wonderful. And if there are Caymanians that return on that BA flight, I imagine the quarantine option at hotels might still be available for them?
Certainly. We'll keep that open. And it's important for people to understand that self-isolation is not an option. It's absolutely mandatory. And because of all of the other things that have happened in terms of the crash of the economy, we now have significant personnel that will monitor, that we are able to deploy to monitor whether people are isolating the way that they need to. Because it would be beyond tragic if you came back and infected your family and your friends, and in the process of doing so, killed off your grandmother, your aunt, your mother, just because you selfishly didn't want to spend 2 weeks in isolation, having come from a very high-risk jurisdiction with respect to this virus. So we are taking this most seriously. Anyone who comes on that flight will be required to isolate.
I think, apologies, Kayla, we lost audio while Dr. Lee was reiterating an important point about DIY masks and considerations in the NEOC. So I think it would be wise if we invited Dr. Lee back to reiterate what he was saying in regards to the issues with masks.
Yes, so thank you for the query about masks, which I understand is going around in the media today. To hopefully rehash everything that I previously said, and I apologize that the sound got cut out, culturally in Hong Kong and in China and in Japan, especially because of the SARS epidemic there, it became the norm for people to wear masks whenever there was the threat of an infectious disease such as this virus that we're now facing. It hasn't been the case everywhere else. Indeed, if you look at Singapore, for example, the Public Health Department in Singapore, the Ministry of Health, does not advise for people to wear masks, contrary to what people might think. But however, there is no doubt that if everybody was to wear masks, then it would protect the community more than it currently is, for the reason that although when you wear a mask you're not protecting yourself, if you're stopping the droplet spread from you to another person, then if everybody is wearing a mask, then you're generally stopping the virus traveling around, that droplet spread. There's also been a query about the aerosolization of the virus that causes COVID, which I thought I might as well address here. There was a report in the New England Journal of Medicine, a letter in fact, about a study. Aerosolization such that the virus hangs in the atmosphere is not a problem in the community. In the community, droplet spread is what occurs. You only get aerosolization when you're in a hospital environment, when you're doing particular tasks such as suctioning down an endotracheal tube, placing an endotracheal tube, or other such invasive airways tasks. So in the community, it is still droplet spread, and that issue was covered in the situation report from the WHO on the 26th of March. I just wanted to reiterate the Premier's point about isolation, because the particular circumstance, if you have been diagnosed with COVID, you fall into a different group, then you fall into an absolute requirement for you and all of your household to stay at home. If public health determines or finds out that anybody has left their home when they've been advised to do so by public health, we will immediately report the matter to the police. I've been speaking to the police today, and they are going to offer any assistance they can in order to make sure that the full force of the law is brought to anybody that breaches the requirement to stay at home if you are a sufferer or live in a household with a sufferer from COVID. Thank you.
Good afternoon, gentlemen. Felicia Rankin-Solins, Radio Cayman. Forbes has written an article commending the Cayman Islands and its government for taking such proactive measures towards COVID-19, placing human life above all. How does that feel being recognized by such a well-known and respected publication?
Of course, you feel good that the actions you're taking is being recognized, and I'm very grateful to the author of it, and I actually sent her a thank you note. But we are just at the start of this epidemic in Cayman, nowhere near the end. So what I would love to be able to happen is that Forbes or somebody else were able to write an article at the end when this is all over and saying Cayman has come through this shining, and there's not been a single death of a local person, and all is well. Until that happens, we can't rest on our laurels. And while I like the encouragement, and because I'm used to getting licks, it's good now and again to get some bouquets. I am by no means complacent about the challenges that we are currently in and those that lie ahead.
And we've gotten reports that you, Premier, had a video call with some of the students that are in isolation. How did it go? Were there any complaints? Is everything fine?
It went very well. There were a couple of requests for things. That's fine. We had a very good exchange, and I impressed upon them the importance of them continuing to remain responsible and through this period of isolation. And I thank them for the degree of responsibility they have shown, and said that they were a model really for the rest of Cayman. So very, very proud of our young people. As I said to them, they're the cream of the crop. They are the next leaders of Cayman. I know it sounds cliche, but they truly are. And it is wonderful to see them displaying such a sense of community mindedness and responsibility.
And for people who happen to see businesses operating when they shouldn't be, who exactly should they call to make these sort of reports?
I mean, it's always tempting to say call the police, but the police are so overburdened.
I mean, there is the NEOC.
Right.
The NEOC number, but
and also if they could send a message to curfew time, because curfew time is monitoring and providing the necessary authorization for businesses that should operate. So if you see a business that you think is outside the scope of the essential services as set in the regulations, then just send a quick email to curfew time, and we'll be able to follow it up with the police or whichever is determined to be the responsible or appropriate agency.
And some listeners from Radio Cayman are concerned about senior citizens who live on their own. We know that there are organizations that are taking care of delivering food for them, but is there any services being held for them to do wellness checks or to ensure that they have a clean living space, that they're doing okay?
Not that I'm aware of. It's a point we'll take on board, but I know persons who are part of the usual list that the Health Services Authority or the Department of Children and Family Services or any of those other agencies are looking after. They would be normally getting those checks and so forth, but not generally. If they're just an elderly person who's living in a community and relatively independent, no, there isn't an established protocol now to go and deal with those. But if people have issues or concerns or need help, then they should feed those concerns and requests into the usual agencies that look after these sort of issues.
Okay. This next question probably be best answered by Dr. Lee. Hi, Dr. Lee. There's some ladies that have spoken to me that are expecting to give birth soon, and understandably they are worried that their newborn could later contract COVID-19. Some of them will be giving birth at HSA, so they're wondering if there anything put into place to ensure their child's safety and their safety during that time during childbirth.
I'm not trying to duck the question. I'm just not the best person to answer that. It'd probably be best addressed directly to the staff at the Health Services Authority. However, I can say, for example, the extension of the no visitors rule is being extended to the obstetric ward and also to the delivery. So although it's clearly a crucial time for bonding, they are trying to provide as much information in terms of photographs and so on to enable the father to do the bonding and to have that relationship at a later time because of this need to try to keep any risk of any threat of infection out of the Health Services Authority. So all of the process, they're looking at that process and trying their utmost to reduce any chance of the threat of that happening.
Okay. I'm not sure if you'll be able to answer this question, but is telemedicine allowed and covered by insurance in Cayman?
Again, I'm not the best person, but I am well aware that there's been a lot of discussion between the Health Insurance Commission and the health insurers on the island, as well as the providers, in particular the private GPs. So there's a number of different codes that all doctors can use in order to have telemedicine, which have been opened up recently because of this threat, so that a lot of the practitioners are able to undertake consultations via telephone. I know that it's not everything, but I think you should be able to do that, yes.
Okay, thank you. That's all my questions.
Yes.
We've finished with questions for the media. We had one on a slightly lighter note for Minister Seymour regarding the jingle open call. How many payments could potentially be awarded to persons?
Thank you for that question. What I'd like to do is give you some information on the jingles call out is what it's not really a competition, it's an open call, which there's a difference. There are 4 categories for the jingle submission, and any genre is permitted. The public health, education, awareness, jingles with coronavirus specific messaging aligned with public health advice, community solidarity and togetherness, jingles with messaging to highlight our collective strength and resolve, hope and healing, jingles with messaging to evoke feelings of nostalgia and gratitude for the silver linings coming from this crisis, support local, jingles with messaging to encourage and inspire the support of our local economy. Up to 3 jingles per category will be selected, which means that potentially 12 payments of $1,200 each will be awarded. Collaboration is possible and encouraged. Jingles will be selected and musicians notified by Thursday, 9th of April.
Thank you, Minister. Any closing words, further words from the panel?
In response to the question from Felicia, I've just had a note from Danny Coleman, who heads up hazard management, saying that anyone who has issues, elderly people who need assistance and so forth, they can contact NEOC under Human Services. They've got a section called Human Services that will coordinate the necessary assistance to them.
Thank you.
I just wanted to say it's important that we recognize everyone, and it looks like we hadn't been recognizing the work department, and they've been messaging me, and I told them I would get this out today. Thank them for what they're doing. I see them on the beat with the police, and we apologize for missing you out, but I think there was some confusion in terms of there used to be lobby with the CBC, and the governor has been saying that a lot. And I also wanted to note that atheists in Italy are now praying. So there is a lot of reasons why I pray here.
Thank you. And a reminder, those numbers mentioned by the Premier, by the Governor, the Emergency Travel Helpline, the NEOC number, those can all be found on gov.ky/coronavirus. There's a contacts page there with all that information. Thank you for joining us this afternoon. Thank you to our sign language interpreter, Ms. Carolyn Powell. We'll be back tomorrow with another press briefing. In the meantime, please visit that webpage. That was gov.ky/coronavirus. Follow along with all the Cayman Islands government social media channels. We're on Instagram, Twitter, and Facebook. Remember to adjust your settings so you receive a notification when we go live with these press briefings. You can find new content available throughout the day. Thank you very much. Good afternoon.
Oh, land of soft, fresh breezes, of verdant trees so fair,
with thee it everywhere. Oh, sea of palest emerald, merge into darkest blue.
Whenever my thoughts fly onward, I always think of you.
Dear verdant island set
In blue Caribbean Sea, I'm coming, coming very soon.
oh, beauteous I'll to thee.
Although I wander far, my heart enshrines thee at homeland. There came an hours I cannot